I'm Leslie Rickey. I'm an associate professor in the departments of urology and obstetrics and gynecology, and I specialize in female pelvic medicine and reconstructive surgery. My practice is devoted to the care of women with pelvic floor disorders. This can include problems with the bladder, vagina, or bowel.
This is your urinary.
Pelvic organ prolapse is a very common condition. Almost all women, as they age or if they've had childbirth, they do get some loss of vaginal support. Once the walls of the vagina start to come down to the opening and then herniate out, that's when women have this symptom of a bulge. The best way to think about pelvic organ prolapse is a hernia. And it results in a really uncomfortable feeling of a vaginal bulge, like something's sort of always there. They sometimes feel like they have to push the bulge back in for comfort or for help with urinating or having a bowel movement.
With the sort of plumping?
Bladder conditions are one of the most common pelvic floor disorders, and this can range anywhere from somebody feeling like they need to urinate too frequently and it's disruptive to their workday, all the way to somebody leaking when they cough or sneeze, every time they try to exercise. There are women that know where every bathroom is. So for a teacher, by the end of the day, she really feels it. For somebody that's standing a lot, for someone that's gardening, for someone that does yoga, these are all the complaints I hear daily. But it's still shocking that women don't come in for these things. There have been studies showing that less than half of them have talked to their healthcare provider about it. I think embarrassment and stigma is part of it, but even more insidious than that is that a lot of women just think it's a normal part of aging. And what I tell my patients all the time is just because it's common doesn't make it normal. There are some really simple behavioral, dietary changes, exercises that can help with mild symptoms, and then really effective medical and surgical treatment options for more severe symptoms. We try to understand what activities cause that leakage, how long she's had it, and also try to get a handle on what lifestyle choices she may be making that may affect the severity or the progression of this disease. The exam is the next part of it. After that, we start to come up with a treatment plan. The start, a lot of times, are lifestyle changes. Watching what you drink, maybe avoiding caffeines and sodas. Pelvic floor muscle exercises are also first-line therapy for both urge and stress urinary incontinence. So sometimes just strengthening the pelvic floor muscles, which is a treatment that we offer right in our office, that can wipe out these symptoms, especially in mild to moderate cases. It's really stunning. The patients are shocked. They sometimes look at me like they don't really believe me, and I say, trust me, try the directed pelvic floor physical therapy and you'll see a difference. And a lot of them are really happily surprised. No surgery, no medicines, and they feel a lot better. We have office treatments, which just use a little bit of local numbing medication. Those are for incontinence mostly. They can have almost instant success, instant results without having to go through a surgical procedure. People come to the office asking about an electrical stimulation they've heard for incontinence. And we can test to see if you're a candidate for this by placing a very thin wire by the nerves to your bladder in the office. If you have an improvement in your symptoms after 2 weeks, then we do go for an outpatient surgery to implant the battery itself. And the best way to think about the battery is a pacemaker. So most people are familiar with the heart pacemaker. This is a bladder pacemaker, so it goes in a little bit different position. At the other end of the spectrum, we have minimally invasive surgeries, either vaginal, laparoscopic, robotic. Now, for people that have more complex prolapse conditions where the vagina has herniated out, that is really where more reconstructive procedures come in. I kind of try to get patients to think about them like plastic surgery almost, because you're trying to reconstruct the part that's coming out. So that can be done through the vagina, but also through the abdomen using laparoscopic or robotic techniques. Because we're able to offer this array of treatment options, especially the minimally invasive ones, people can be in and out of the hospital on the same day or just one night. One of the things that I hope my patients leave the office with is a sense of hope and belief that they're going to get better.